Hi, my name is Randy Beckett, and I'm a psychiatric mental health nurse practitioner. And for the past 8 years, I have been taking care of people who live in long-term care facilities across the United States. And many of these folks in long-term care facilities have dementia. And this has a huge impact on, of course, their lives, and then also the lives of their family members, their loved ones, and of course the staff in the nursing homes, everyone from the administrator to people in dietary to housekeeping, and also on the providers that take care of people with dementia. It's a widespread problem. In the United States, 10% of US adults over the age of 65 have dementia. And 70% of people in long-term care facilities have dementia. And after that, we also know that 11 million family members and caregivers, friends, other loved ones, are impacted by this huge number of people with dementia. So I want to say, first of all, that you are not alone. There are a lot of people in your situation, and it's very confusing, and there are a lot of emotions to go around it, and we're going to talk about some of those today. Now, one thing we have to start off with is that there's no cure for dementia. There are some medicines that in some people for some period of time that can slow the progress of dementia. But it is a progressive disease, and the medicines really, unfortunately, aren't that much help at this point. So we have challenges on how to help people with dementia and how to help their caregivers. And I want to keep on reiterating through this brief talk that we're going to do today that you're not alone. There are so many people and so many groups that can help you on Facebook or in your churches or in your communities. You are not alone. And we're going to talk about some of the emotions that impact you today. So, dementia is caused by many things. Alzheimer's, very common, is vascular dementia caused by strokes or mini strokes. Then you have dementia from Parkinson's disease and dementia from alcohol use over a prolonged period. And so there are many types of dementia, and they're all very challenging. And what happens is that people who are the loved ones of people with dementia have very common emotions that they share to varying degrees. For example, guilt. Now, I've had 6 members of my family have dementia and be in a long-term care facility. And my grandmother and my mother both said years before they developed dementia, Randy, don't ever put me in one of those places. But at some point, we could not care for either of them at home due to the progression of the disease. For my grandmother, she lived to be over 100 years old, and her last 10 years were spent in a nursing home with severe cognitive impairment dementia. My mom was a little less, and she was able to live in assisted living. But still, it's a challenge because I've talked to sons and daughters that say, what am I going to do? I promised mom that I would never, ever put her in a place like this, and now I have to do that. It's what's best for them, and it's what's best for you at some point often. So that guilt is based on us doing what we call shoulding on ourselves. I should do this, I should keep mom at home or dad at home, or I shouldn't put them in a home. And all these things build up frustration and guilt because there are no definite rules on what to do. We just do what's best for our loved one, and often staying at home is not what's best for them or for the rest of their family. And what I always ask is if your mom could understand what's going on right now, and she knew how much pain this was causing you or your dad, would they want you to keep her at home, or would they say, I don't want to be a burden? It's an important thing to think about. There's anger at dementia, anger at what happens in nursing homes, whether there's anything bad or not, but just the frustration and misunderstanding and miscommunication with physicians and nurse practitioners and everyone. There's all kinds of emotion that comes up around that. And just like, why is this happening to our family? It's frustrating, especially negotiating a healthcare system that most people aren't prepared to tackle. It really helps to have somebody in your family, or to get somebody who can help you navigate this complicated system of long-term care and dementia care. It's confusing. Why is mom doing this? Why is she doing that? What does this mean? What does that mean? What are all these medicines? It's very confusing and exasperating, because we just don't know what's going to happen and where things are going to go. And with that, all of these emotions for caregivers and for loved ones comes fatigue. It's a burnout. There's loneliness, thinking that people don't understand. And if they haven't gone through it, or else if they're not a professional, they may not understand exactly what you're going through. So that's very, very difficult. It's actually a form of grief when somebody gets dementia, because you know that this is not going to get better. You know that eventually they're going to lose many of their faculties and often the ability to communicate with you, others, and through the different stages of dementia, going from at first just kind of being confused and forgetting things to not even knowing their own names, or sometimes recognizing their own spouse or partner. So that's difficult. Now, there are several things that I like to talk about with families. And one of them is, why doesn't mom remember me? And when you encounter mom and you're talking with mom, and mom doesn't remember any of us, or she remembers my other 3 siblings but doesn't remember me, or dad doesn't remember mom, or many things that they don't remember. And it's just part of the disease, unfortunately. And they will have good days and bad days. You might go in one day and somebody might be very lucid and able to have a great conversation with you, and the next day it might be much worse, okay? And then along with that, there are behaviors that we call them in the long-term care facility lingo, okay? Aggression. Sometimes people with dementia can be very, very, very aggressive, not only against staff, like during cares, resisting cares, hitting, pinching, biting, but also towards family members, and also towards other residents. There is resident-on-resident violence that occurs in these situations. And once again, it's that frustration. Mom, dad, auntie, they were never like this. They might start swearing, using just tons of profanity. And they've never sworn their entire life. What is going on here? Other behaviors include sexually inappropriate behaviors. Someone who is just not doing anything like this in their former life. Okay, so there's the crying. Sometimes people just cry just all of a sudden for no reason, or laugh all of a sudden for no reason. And also people do what we call exit seek. They are on a path to get out of that building as soon as they possibly can. Okay? And because most people that I've talked to, and I've done about 20,000 visits in long-term care facilities, is that everybody just says, I just want to go home. I just want to go home. Why won't you take me home? And they're going to say that to you over and over and over again. Please just take me home. Why are you doing this to me? And then all the guilt comes in. Okay? Now, the other thing is, as far as a psychiatric provider, I can tell you that sometimes these behaviors we're discussing are due to depression and anxiety or other mental health disorders, which are treatable with medication And depending on what stage of dementia the person is at and how much they can participate, often with talk therapy or psychotherapy. Often they will reveal during a talk therapy session something to a therapist that they wouldn't tell anyone else. I've talked to people, men who were in a war, who never, or had never told anyone that they had these horrible nightmares. Women who had been assaulted sexually or otherwise as a child, or raped, who never told anybody. So there is a role for psychotherapy even for people with dementia, as long as they can participate. And then the medicines that we can use, maybe they have a prior history of depression and anxiety. Well, it's probably not going to get better with dementia, or bipolar disorder, or schizophrenia, or any mental health disorder. And these medications have to be usually continued, although it is incumbent upon the provider, the prescriber who's taking care of your loved one, to try to reduce these medications as much as possible while maintaining the maximum mental health. One thing that I've encountered a lot that's difficult to discuss is sometimes people will say, I come and see mom every day. I come at first thing in the morning, make sure she gets breakfast, and then I stay past lunch, and then I leave for a little bit, and then I come back 5-7 days a week. And although I know that often seems like the best thing to do, often it is not. Because number one, for people with dementia, that kind of stimulation can stimulate them to be more anxious, and then when the family member leaves, they get more anxious. It can be consoling, but also sometimes it prevents them from becoming socialized into the social scheme of the facility, assisted living or nursing home, to go to activities, to participate in meals, to go on walks, to go on outings, wherever they're going to go, because they're waiting for their son or daughter or loved one to come. So I often recommend that there be a happy medium to allow the loved one to become socialized to their environment, but then also you have a life too, especially spouses. If you have a spouse that has dementia in a long-term care facility, and often in the later stages, they won't remember if you were in the room and then walked outside and came back 5 minutes later. They won't remember that you were there 5 minutes before. So, you have to have a life. You have to go on. Maybe you have grandchildren and children that you want to spend time with. And I really recommend that you don't make the long-term care facility or the nursing home the center of your life. Okay, because that can be very, very damaging to all of you. Now, a couple of things that I want to touch on is I remember sitting with my mom in the hallway with 3 other residents of her assisted living facility, and we went for about 2 hours, about every 10 minutes, with them having a discussion about when does dinner start, okay? And I recall, mom, and I struggled with this myself, mom saying, well, I remember this happened, or grandma said, this happened or that happened back then, and it's absolutely 100% wrong. And initially, I would correct them. And then I suddenly had this awareness that this is an exercise in futility. All it does is create a conflict between me and them, and they're not going to understand it. They're not going to believe it. They think we're arguing with them. And all it does is raises my anxiety and my frustration. So do not correct people your loved ones, when they say something wrong. Please don't. It's going to be very frustrating, even if they call you the wrong name, or they say they've never been married, or I don't have any kids. Well, don't you remember so-and-so? No, I never had any kids. I mean, it's just, or they regress to an earlier part of their life. Or sometimes you might go in and you might see your dad holding hands with another woman because he doesn't remember he was married. And, this is not personal. This is part of the disease. So this is where understanding, empathy, and kind of letting all this judgment go because they really don't understand. And it's not an attack on you or your family. Also, it's a good idea not to kind of come up behind people and tap them on the shoulder when they have dementia. They often startle very easily. You want to make sure you're in front of them and talk to them directly. If there is something that's going to be going on, it's often good to try to explain it to them the best that you can. And all those things are very important. Just remember, have to take into consideration that they often, even the early stages, aren't going to remember and aren't going to understand, and just please be gentle with them. Now, one thing that's interesting is that if your family member or loved one has Medicare, that Medicare has a benefit for your loved ones, on your loved one's Medicare, that family members with or without the Medicare beneficiary president can have psychotherapy, not medication management, but psychotherapy with a therapist to help them work through the emotions that they're having related to their loved one's disease. So yes, your loved one's Medicare will pay for you to have treatment as long as it's related to their disease and the consequences of that disease and its effect on you. Psychotherapy to help understand that, because we all realize is that if the family members are healthier, and it's going to be better for the resident, better for the staff, better for your whole family, everybody involved, we get a better outcome. So that's really important. The last thing I want to talk about is something for you to take care of yourself, and it's called self-compassion. So often when people are so hard on themselves about shoulding on, I should do this, or mom should remember that person, or I should go there every day, is to take a step back and say, if you were talking to a friend of yours and that friend said, my mom has, or dad has advanced dementia, they're in a nursing home, I can't go there every day, I have other obligations, I'm feeling so guilty, like I'm abandoning them, that they really need me, and they're just sad and they just don't know what to do. What would you, just think for a moment, what would you say to that person who told you this story? I think you would comfort them. You would say, hey, this is a really, really difficult situation, and you're doing the best you can, and this is a very difficult disease. There are millions of people that have this disease, and just please be easy on yourself. You're a good person. Take care of yourself. Go have lunch with some friends. Don't go there. You don't have to go every week or every 3 days, okay? But now what I want you to do is turn that around and do that for yourself, okay? That be kind to yourself, and that is recognizing that you're having a very difficult time. Okay, I'm having a really hard time right now. This is so awful that I don't know what to do. I'm confused, I'm angry, I'm frustrated. There are so many emotions going on in my head, I don't know what to do. And just recognize that you're struggling, because sometimes we just want to put it out of our head and not recognize that we're struggling. And the second thing is to remember that, as I stated earlier, there are millions of people in the United States who are struggling with this exact same issue every day. You are not alone, okay? And there are other people that are going through this exact same thing. Every problem you're experiencing with some variation of complication and intensity has been experienced by someone else, and someone else is going through it right now. If you can find a group, or like I said earlier, to join with, or just somebody on the phone to talk with that'll just listen, that would be great. And do some self-care. Take a nap when you need it. I know this all sounds so trite, but go for a walk. Go out to dinner or lunch with friends. Have a cup of coffee with a friend. And just do something that, if you're into prayer or meditation or you golf or whatever it is you do something for yourself, because you're really going to need to take care of yourself in the long run, because this can often be not only a progressive but a lengthy disease. So I want to thank you for listening today. I hope this has been helpful. I hope that you have gained some insight. There are lots of resources. We're going to have at the end of this video a link or two for you to access information about dementia and caregiving and things that people go through. So please take care of yourself. Please be easy on yourself. And remember, self-compassion and shooting on yourself really doesn't help. I want to thank you. My name is Randy Beckett, and it's been a pleasure.